Hello, everyone. Welcome. Thank you for joining us today. Happy Friday. I am your host, Dr. Roberta Westbrook, and we are at the Campus for All Animals, the Houston SPCA. Thank you for joining us. If you were with us last week, you know that we are talking about vaccinations in pets because it can be so overwhelming and there's so many questions that you might have about which vaccinations my pet should have, how frequently, does my pet even need vaccinations and why? There's so many questions out there. And so I'm going to help you answer those questions today. Last week, we discussed vaccinations in dogs. This week, we're going to talk about vaccinations in cats. But before we get too far into our discussion about cat vaccinations, I want to introduce you to our lovely friend here. This is Duke. Look at handsome Duke. Duke is available for adoption. I want to invite you all down to our Campus for All Animals this weekend. Bring your family, bring your friends, and come look at all the pets that we have up for adoption. Duke is 14 years old. And he was actually abandoned here. And so we would like to find him a new forever home. He's in very good health. He is a geriatric pet. And so we would like to help him find his forever home. Duke is very sweet here. Handsome, handsome boy. So come on down. There's no appointment necessary to look at our pets up for adoption. We do require masks when you're in the building, but we are here to help you. And so come on down and see us. Get your questions together about vaccines and cats. Start thinking about it. I'll help you answer whatever questions you have. And we're going to have a cat friend who's going to join us in a few minutes, who I can show you where we give those vaccinations and which vaccinations we give in cats. So great to have you guys. We're going to let Duke hang out down here and just run around and enjoy himself. Hope we see you guys soon so that maybe Duke can find his forever home. So, vaccines for cats, feline vaccines. So, as we mentioned last week, one thing that we mentioned is that there's some vaccines that are what we consider core. When you hear the term core vaccines, we are talking about vaccines that are recommended. They're going to be recommended by any veterinarian. They are the vaccines that we feel like are going to keep cats healthiest for the longest portion of their life. It's usually the vaccines that are preventing infectious and contagious diseases, some of which have the potential to be fatal. So core vaccines are the ones that we feel like every cat should get no matter what. Outside of the core vaccines, there are other vaccines that can be given just because a pet has a certain lifestyle. So you might have a cat that's indoor only, or you might have a cat that goes indoor and outdoor. And so your family veterinarian can help you determine whether or not your cat needs vaccines because they are having a different lifestyle. So the vaccines for outdoor cats are going to be slightly different from those that are indoor. And so we'll help you work through some of those questions if you have them. And so as you can see, this adorable, adorable cat here. How cute are you? And this is Lisa. Lisa, tell us about your cat that you have here.
This is Meadow.
Meadow.
About 4 or 5 months old. She's been in foster care with me at my house being spoiled until she got big and strong, and now she's ready to go find her forever home.
Oh, wonderful. So Meadow is just in great health now. Meadow is also going to be up for adoption this weekend. So cute. So if you're looking for a cat to join your family, oh, look at that. What a beautiful cat. Meadow is going to be a good option for you. Oh, so great. So what vaccines are considered core for cats? The first one, we tend to abbreviate vaccines. I mentioned that last week that we put all these letters to the vaccines to sort of abbreviate them so that we don't have to say all the names of the diseases that they're going to prevent. But for cats, one of the most important core vaccines is called FVRCP, or some places might abbreviate it HCP. But this is a core vaccine that prevents contagious diseases in cats, usually viruses that prevent severe upper respiratory infection, and even a parvovirus. Cats can actually get parvovirus as well, and it can also show up just like parvovirus in dogs, and so it can cause bloody diarrhea, vomiting, excuse me. And so we vaccinate against that as well. And so that FVRCP vaccine is what we consider core for cats. In addition, the rabies vaccine, well, this was the FVRCP. And sorry, it might be hard for you guys to see that there. And we also have the rabies vaccine that is core for cats as well. So we are going to give this first vaccine, the FVRCP vaccine, that's going to prevent these infectious and contagious diseases in cats. And we're going to give that to Meadow so that she'll be all current on her vaccines before she goes up for adoption. We mentioned last week frequency as well. And so when we are vaccinating kittens, the vaccine frequency is higher than it is in adult cats, just like we mentioned in puppies. Whenever pets are very young, what we want to do is we want to stimulate their immune systems to become competent and mature and able to recognize disease really quickly and fight it off. Well, when we have young animals like young kittens, the vaccines help them to stimulate their own immunity, and they need to be boosted frequently because sometimes the kittens will have antibodies that they receive from their mother that can actually inactivate the vaccines. And so we booster those vaccines frequently so that we can make sure that the maternal antibodies from the mom have left the body, and that the vaccines that we are administering are going to be able to take over and help the cats to stimulate an adequate immune response to fight disease. So as they get to be adults, though, their immune systems are competent and they're able to recognize disease and fight it off very quickly. So we're going to give Meadow an FVRCP vaccine. And this vaccination is just given underneath the skin in what we call the subcutaneous space. If we kind of like tint up the skin in cats and dogs, there's like a space there that we give the vaccine in. So it's not in the muscle, and it's not too painful. Sometimes they wiggle a little bit with the needle entering the skin, but usually they tolerate it very well. And so we expect her to tolerate this really well. Thank you. And for this particular vaccine, again, every veterinary hospital may have a location that they like to give each vaccination. For this particular vaccination, we like to give it on the right side, kind of lower down in the limb. In some cases, you guys may have read about, there are certainly some cases where animals can get vaccine reactions. And so we like to administer those vaccines lower down on the limb so that if they have reactions, we can treat it more easily. Okay, Meadow. So Meadow's had an exam by veterinarian, and so we know that she is healthy enough to get a vaccine. And so it may be difficult to see here, but we're going to give this vaccine here just under the skin. Oh, what a brave kitty. She didn't move or anything. What a brave kitty. Wow, great job, Meadow. Great job. So what a wonderful cat. And so Meadow also is old enough to receive a rabies vaccine. So if you're wondering when your pet should receive a rabies vaccine, it's between 12 weeks old and 16 weeks old. And the rabies vaccine is a vaccine that does not need to be boosted in the immediate future. Rabies vaccines can be boosted a year later. So that's one of the vaccines that doesn't have to be given very frequently after the first initial vaccination. Does anybody have any questions about vaccines so far?
Yep. So Jamie has a question. She has indoor cats, and she was wondering if is it, if it's different on whether she needs to vaccinate her cats or if there's a different kind of frequency for the amount of vaccines you get.
Absolutely. So for indoor cats, the frequency usually just depends on age and whether or not they've ever had vaccines before. But the fact that your cat is indoor could mean a couple of things. Your cat may not have regular access to other cats and to other infectious diseases from cats. And so I still think it's necessary, and veterinarians and organizations that help us to develop vaccine protocols would say that your cat still needs the 2 core vaccines that I mentioned earlier. The first one, FVRCP. This prevents the most common upper respiratory infections. It also can prevent parvovirus. And so that is a vaccine that your cat needs. And usually if your cat is a kitten, your cat's going to probably have to have 1 or maybe 2 boosters of that vaccine before her immune response is healthy enough and strong enough to fight off that disease if she encounters it naturally. The second vaccine that your cat needs is the rabies vaccine. So if your cat is between 12 and 16 weeks of age and has not received a rabies vaccine, that's the other vaccine that you need. Now, there are some other vaccines that we tend to give to cats that are indoor and outdoor because they're coming into contact with more disease and cats with unknown history. And some of those are the feline leukemia virus vaccine and the feline immunodeficiency virus vaccine. Those are less common, and so certainly may not be given to a cat that's strictly indoors.
So Mark would like to know, what are the side effects to look for after your cat or your kitten has a vaccine? And a follow-up to that is Alexi wants to know, how can you comfort your cat after a round of vaccination?
Oh, that's wonderful. So the first question is, what reactions should you look for? Or should you be expecting? Well, hopefully the normal thing is to not really have any reaction at all. Again, it's not uncommon if your cat is a little quiet for the day after they receive the vaccine. But what you want to look out for are severe reactions such as vomiting, diarrhea, swelling, particularly in the area where the vaccine was given. But also it's possible to have systemic reactions where the face gets swollen and the pet gets very itchy. I will say that's more common in dogs. We don't see that too often in cats at all. Cats tend to have less vaccine reactions, and so we don't see that too often. However, long term, there are some times where cats will get a vaccine reaction that lasts for several weeks or months. And it's called a vaccine sarcoma. And so there are some vaccines that can actually cause tumors at the site of injection. It's not very common, but when it does happen, tends to happen in cats. And so one thing you wanted to look for is at the site of injection, any swelling that does not go away. So if it's days or weeks after your cat receives the vaccine and there's a swelling in that area and that swelling doesn't go away, I would definitely contact your family veterinarian and have them looked at to make sure it doesn't turn into something more serious like a vaccine sarcoma.
So Jay wants to know, it's actually a 2-part question. I think you touched on that as far as what the law says for vaccinations for cats. I think you said that you had mentioned that it was the rabies one.
Yes, rabies is the vaccination that is required by law. And that's because rabies can be transmitted to people, and rabies is considered a fatal disease. And so because of that, because of the public health risk, it is required by law that your pet get a rabies vaccination. Now, your pet should not receive that vaccination prior to 12 weeks old, and it should be given by the time they are 16 weeks old. And your veterinarian can help you follow up. Now, usually that vaccine is boosted 12 months later. So a year later, it's boosted. And then after that initial booster, talk to your veterinarian, because after that, it can be given every 3 years. So that's for the rabies vaccination. Absolutely.
And here's also another follow-up about feral cats and vaccinations. Does that help them? Because I think a lot of people don't understand about feral cats.
Absolutely. Feral cats are cats that live out in the street, in the community, and usually don't have a regular caretaker. These cats are generally not used to handling, and so it can be difficult to make sure that they get their vaccines on time and regularly, right? Because they're not going to usually allow people to hold them, to restrain them, to administer a shot. We do have wonderful members of the community who help to take care of those cats in the community. and bring them into veterinarians and get them vaccinations. And absolutely, those vaccinations help. So those are the cats that are at greatest risk for getting contagious disease because they're interacting with several cats in the environment, many of which do not have adequate immune responses. So it's really important that even feral cats get regular vaccinations. And so people oftentimes will bring those cats in, catch them, bring them into veterinarians and get them vaccines, and it can still be very, very helpful.
So Patrick wants to know, are there any vaccines for cats out there that would be considered optional?
Absolutely. So there is one, for example, called it's feline immunodeficiency virus, or a vaccine against FIV, and that would be considered optional. It's not a core vaccine. Usually FIV is a contagious viral disease that is spread through bites, but through biting and fighting. And so we tend to see that particular disease highest in feral cats, particularly intact male cats. So male cats who are territorial tend to fight more, and they tend to spread this disease. So that might be a population where the FIV vaccine could be used. However, there are some complications with the vaccine. Once we administer that vaccine, the cat will always test positive for that disease. So even if we vaccinate the cat and prevent them from getting it, sometimes it's difficult to know whether they actually have the true disease later on in life. So that would be one example of an optional vaccine. In addition, the feline leukemia vaccine is also optional. And so I should say that you should speak with your family veterinarian about your cat's lifestyle. Are they indoor, outdoor? How many cats are they coming into contact with and when? And that can help us determine which ones your cat may need. But comforting them, I know there is a question about how you comfort your cats when they're getting vaccines. And I try not to restrain cats too much. You know, cats just like to kind of sniff around and explore their environment. So usually when I'm vaccinating a cat, I kind of let them do whatever they normally do, kind of crawl around the table, pet them, and then kind of sneak in that vaccine when they're not really expecting it. And so just letting cats kind of do what they normally do and not interrupting their normal life is probably the best way to comfort them when they're about to get a vaccine.
So Elizabeth has a question, and I know this information, we don't know what kind of vaccination that her cat has had, but without that information, what vaccinations, if any, would a cat need at 1.5? Say you found a cat or adopted a cat.
Absolutely. So let's say you just found a cat. We don't know if the cat's had any vaccines or not. And that happens every day for us here at the shelter. We get stray cats. We don't know if they've had any vaccines before. And so what we start with are those core vaccines, 1.5 years. They've got to have that FVRCP vaccine that you saw us administer to Meadow here. Because again, that's going to prevent the most common bacterial and viral diseases that we see in cats. So it's called FVRCP, but other people may call it HCP. There's a couple different abbreviations, but essentially it's the same vaccine. So we would give that one, and we would also give the rabies vaccine because that one, again, is required by law. So if I just found a cat and I estimated the age to be about 1.5 years, those are the 2 vaccines that I would give. Now, because I don't know if this cat has ever had vaccines before, I would booster the FVRCP portion. So I would booster that just to make sure that we've given adequate chance for the immune system to kind of do what it does, get adequate antibodies. And that's what research has shown. Research has shown that for most vaccines, they need at least 1 booster to try to stimulate the immune response to do what it needs to do to fight those diseases.
Okay, so Joe has a question. She wants to know about if cats and dogs live together, is there a special kind of vaccine that they need to get, or we just kind of stay the same?
That's a great question, but there's no special type of vaccine that you need to administer to your pets just because they live with dogs or vice versa. So for cats, it's still the FVRCP and rabies, and then any other vaccine that you feel like your veterinarian says is important for your cat's lifestyle. And for dogs, last week we mentioned the vaccine was DAPPV or DA2PPV. That is a core vaccine for dogs. And in addition to that one, the rabies vaccine for dogs. And then there's certainly some other lifestyle vaccines that we recommend for dogs, depending on how often they're going to come in contact with other dogs. So there's the kennel cough vaccine. We administered that to a dog last week. That's a very common one, and most dogs do need that one. But there's no special vaccine that you need to get for your cat if he or she lives with a dog, or vice versa.
What if your cat skips a vaccine that requires, more than one shot? What do you do?
Yes, if your cat skips a vaccine. So, I mentioned boostering these vaccines frequently when they're kittens and less frequently when they're adults. They usually don't need more than one booster. And so will you repeat the question? I'm so sorry.
Oh, no, it's okay.
I start talking and then I forgot which question.
There's so much going on. We got Duke over here, and then we got Kitten over here. And then I crossed off my question. So no, if there are any, we talked about optional vaccines. We talked about dogs and cats that live together. Oh, what happens if your cat is supposed to get a booster and you skip it?
So sorry, and you skip it. My mind was going on a different train of thought. So yes, so if they miss their vaccination, so it depends on where they are in the series to begin with, but sometimes your veterinarian may decide just to kind of start the series over and just pick up where we left off. So if your cat is a kitten, let's say your cat is 8 weeks old and we gave a vaccine and your veterinarian said to come back when your cat is 12 weeks old. And so at 12 weeks old, you missed that one. Then what happens is, let's say you came back at 13 or 14 weeks. And so you kind of missed the time for that. Your veterinarian may decide to give an additional booster to cover that gap in time. And so it could just mean that your cat has to get that last shot kind of on the back end there. But in some cases, depending on how late you are for that vaccine, we'll just kind of pick up where we left off. So sometimes being days late is not a big deal. But if you're weeks or months late, your veterinarian might feel like we have to booster that vaccination again. Thank you. Sorry.
Awesome. Okay, well, I think we're going to wrap. I know next week we're going to be, we need questions to get ready for questions for spaying and neutering next week.
Great.
Is there anything you want to tease about that?
Yes, please. It's one of my passions. So, working in shelter medicine, we see so many pets that come in, they're abandoned or unwanted. And so we really feel that it's for the best interest of the pet because of their health and to prevent pet overpopulation that you consider spaying and neutering your pets. And I am happy to answer all your questions about that next week. Now, start coming on down to us to the Campus for All Animals. This weekend, we are going to have some specials for senior citizens who want to adopt pets. So if you are interested in adopting a pet and you're a senior citizen, you're over 60 years old, you are 60 years young, then please come on down, take a look at the pets that we have for you. Having a companion in your home can do so much good. And so look at Duke. Duke is considered senior himself. So what a cutie pie. He could make someone a wonderful senior pet. So come on down. Thanks again. We'll see you next Friday. We'll be talking about spaying and neutering. So get your questions together. But thank you for joining us, and we'll see you next week.